Okay, well, we're pleased to be joined by Chantily Malibago. Chantilly is a director of real estate development in healthcare for Mortenson. And how are you doing today, Chantilly?
Brian, I am doing well, and it's a pleasure joining you today. Thank you for the opportunity.
Absolutely. Well, thank you as well. And we want to talk a little bit about a report that was recently released by Mortenson regarding the pandemic and its impact on healthcare environments and sort of how it informs decision making when it comes to existing healthcare facilities and new facilities as well, I assume. Um, I believe the report was released in December, so it's pretty timely. Can you just talk a little bit, I guess, first of all, about your reason for doing this report and kind of how you put it together?
Sure. So as you're familiar with, Brian, Mortenson is one of the leading healthcare contractors and developers in the U.S. And we regularly speak with our healthcare providers and other leaders about what's happening in the industry. And so to be able to best serve our customers, it's critically important for us to understand the challenges our healthcare partners and customers are facing so that we could face, these headwinds and these opportunities together. And our last industry report was done in 2019, pre-pandemic. And so we wanted to get a current read on some of these challenges and opportunities that are facing the industry.
Okay, well, it's a great topic and very timely, of course. And, we're certainly not out of this pandemic yet with all the different variants that you hear about. So
What's after Omicron?
exactly right. So we're definitely not out of the woods. So it's very timely. One of the things that jumped out to me was 8 of 10 respondents said their facility investments in the next 10 to 12 months will be at or above pre-pandemic levels. Can you expand on that a little bit and what sorts of investments are they talking about?
Sure. So we did see a pause by healthcare providers over the past couple of years in dealing with the pandemic. And of course, many are now indicating further investments will resume. Now, during this pause, we saw a number of healthcare customers quickly, reallocate and reprioritize capital investments that would immediately aid in addressing their pandemic response. So this might have been, reserving cash and capital for PPE, cash and capital for labor, et cetera, as well as pivoting capital to expand their telehealth infrastructure. And in many cases, doubling down on artificial intelligence, predictive analytics, or other technologies to better forecast care demand so that they could better resource for staffing, supplies, and even financial forecasting. And so this, of course, when you have a limited pool of capital to draw from amidst a pandemic where financial pressures are looming, this of course means a prioritization and disciplined approach to that capital investment. Now, since then, what we're hearing from our customers is that the lessons learned over the past few years are going to influence changes in where investments are being made, including an emphasis on, the inpatient space, whether with infrastructure upgrades or repositioning of space to create some flexibility and adaptability where we can flex along acuity levels and be better prepared for infectious diseases should another pandemic occur, which we know that can be part of the future, or simply to coexist with an infectious disease like COVID-19. And also really to flex with the changing needs of communities, as our communities are aging, as our populations are diversifying and growing. Now, this adaptability also extends into the ambulatory and outpatient settings where we expect continued investment, especially as systems are looking to continue segmenting their patient populations, keeping some of the higher acuity care or the sickest of the sick in hospitals so that they could create safer environments to deliver outpatient care, such as certain ambulatory surgeries or other procedures that can occur in these outpatient settings. So one last comment just to add to that, because I think earlier, Brian, you might have asked, when we might have done the study, or how did this take place. So we did this study as part of the ASHE conference that took place, I think it was early fall of last year. And so I think we have to take into consideration that, the study was performed before the new variant, Omicron, and before the winter surge. And so it won't be surprising, if some of those capital plans weren't set yet, it won't be surprising if we see some of the initially planned investments pause as we continue to ride through these waves.
Yeah, interesting. And one of the things that sort of jumped out at me was the importance of taking care of the caregivers as well. We all know that the healthcare workers have been just heroic in what they do. And at the same time, it's a stressful job, obviously. And can you talk a little bit about some of the how future designs might address the needs of the health caregiver in terms of whatever it is, respite space or whatever they need? Can you expand on that a little bit?
Absolutely. And Brian, I think you touched on it. Our healthcare workers, especially frontline workers, and even back office workers that are supporting what's happening on the front line are really, heroic efforts is the right words. And so, I just want to pause, extend my gratitude for what our healthcare industry is tackling today. In terms of our study and what some of our healthcare customers and some of the healthcare leaders are talking about and where they're focused on, yeah, safety is number one. It received one of the highest ratings in our study, followed by respite and wellness spaces. And as part of safety, first and foremost, that was and is ensuring proper ventilation, air quality, pressure. This has been given a priority in learning during the pandemic, along with having convenient access to the tools that they need to perform care, like PPE. Considerations for respite spaces is also a priority, or I should say, is also a topic that our healthcare customers and healthcare leaders continue to contemplate. And this could be incorporated as part of the design of the facility moving into the future. But even despite that, I should pause and say that some of these trends that we're talking about in terms of wellness spaces, in terms of respite, flexibility, these have been trends that were occurring pre-pandemic, especially as the care delivery model continues to change and continues to evolve as new technologies continue to arise. And so what we're seeing in terms of design approaches can range anywhere from design approaches that are truly done to facilitate that care delivery process. It might mean minimizing, as an example, the number of steps between provider and staff and patients so that you could drive a more efficient care delivery process, so that you could drive quality in that patient care experience. It could also include simply, incorporating, respite spaces or bringing in design elements that really, today's worker, we talk about sometimes the corporate setting where today's worker, wants that natural light. For a long time, they have enjoyed those collaborative spaces. We'll see how that translates into the future. But some of those, amenities that we see typically in the corporate space, coming into the healthcare arena. And as it relates to wellness, some systems are also integrating wellness strategies. So, maybe they're wellness facilities that they offer to the community, not just as a way to manage their patients' health upstream so that you could help maintain a healthier community, but also as an amenity to their providers and staff.
Yeah, there's certainly a lot of different layers to this. And, again, it's a fascinating report that you put together here. What kind of, how many responses did you get? Do you know offhand?
That's a great question. I might have to come back to you on that number. So we rolled the survey out as part of the ASHE conference, and drove, gosh, I think we even extended kind of a responsive period afterwards, but we could certainly circle back with kind of the number of respondents that came back to us.
Okay. And just from a cost standpoint, how much can a healthcare provider expect to spend on some of these improvements? I would imagine there's quite a range that they could do, from maybe some relatively small things to full-blown renovations or even new construction. What's your what are your thoughts on that?
Yeah. Um, so I'll answer that maybe in a couple of ways. So first, you know, some of the design approaches that were being implemented by some health systems pre-pandemic really didn't see any significant cost increase um, in overall, I would say, project delivery. You know, part of something to consider as you're thinking about, well, what should we incorporate as it relates to maybe a respite space or a wellness space, or what type of clinical layout should we apply to our clinical setting, as an example. Some of it really is driven by just the size of the support spaces, some of the sizes of those respite spaces. Having said that, we are in a very dynamic environment right now. We hear continuously that our healthcare industry is being challenged by supply chain issues, and we are also hearing that across other industries as well, including our own. And so these cost fluctuations really is a consideration of what is the appropriate space configuration, where the appropriate amenities a healthcare system or provider should bring to their system.
And can you mention any specific projects you're working on that where some of these trends might be
Yeah,
reflected?
yeah, absolutely. We have, I would say, three customers where, both pre and kind of during the pandemic, where, some of these trends are already taking place. The first, of course, is in our backyard with Alina's Abbott Northwestern neural build out. It's a 43,000 square foot neuroscience unit that use some modular wall systems for both their inpatient and ICU rooms, really to provide that future flexibility in the healthcare setting. And this project also included what we talked about earlier, which was those break rooms that were located on the exterior wall so that you could have some of that increased daylight, as well as integrating spaces that would promote well-being among the providers and staff, as well as a design that was that increased the efficiencies between the care team to interact. Another project where we're seeing some of these trends is with Providence Health. And Providence Health is a $25 billion health system across several states in the US. This is for their 105,000 square foot integrated health and wellness outpatient facility in Hillsboro, Oregon. And we started this project at the onset of the pandemic. So this gave our team an opportunity to work with Providence to evaluate what potential changes should we be incorporating in this project. Now, Providence is a system that continues to advance innovation in its facilities. They were already on a journey towards flexibility, and so to adapt, really so that they could adapt to that ever-changing healthcare landscape. And so this project was designed for both provider and staff engagement, as well as the patient experience in mind, with some collaborative work places to promote that engagement both internally and with the local community, as well as improve respite spaces, again, bringing in some of that daylight along those exterior walls and increasing some of that natural light into the facility. And the last project I just want to touch on is Aurora's Mount Pleasant Medical Center, which is a almost 300,000 square foot healthcare complex, and has both the medical center and an adjacent medical office with in and outpatient care at that site. And some of the improvements in this complex includes, again, those collaborative spaces that are designed with flexibility in mind, movable furniture solutions, improved ergonomics in the respite and break rooms, and of course, places for provider and staff to touch down. And if anything, some of our healthcare customers, like Advocate Aurora, like Providence, have also rededicated exam rooms or kind of reconfigured exam rooms in a way that was flexible to accommodate some increased telehealth services as well.
Great stuff there. Any other takeaways from the report? Anything else you'd like to touch on? I'd certainly encourage people to read the whole report, obviously, for themselves. And but what are your parting thoughts?
Well, my parting thoughts to, I guess to our listeners out there is as they're kind of thinking about, healthcare, care delivery in the industry, we're in a place of transformation, right now. I think we saw how the healthcare industry was able to quickly mobilize to address the impacts of the pandemic. And so we're in a place of transformation that's going to continue to further integrate technology. It's going to continue further challenge us to think of ways where we can deliver healthcare in settings that are the right care in the right place at the right time. And so, as we're moving forward and into our new normal with this pandemic, and hopefully one not as great, what will that future of healthcare look like? Let's remain nimble and let's walk alongside our healthcare partners and customers.
Great. Well, that's great insight. And again, if anyone's interested in reading the full report, can they just go to Mortenson's website, or where do they get a copy of that?
Absolutely. They can go to mortenson.com and access the report on our healthcare page.
Great. Well, thank you so much for your time, Chantily. I really appreciate your time, and it was a interesting and fascinating conversation. So good luck.
Likewise, Brian. Appreciate it. Thank you so much again for the opportunity.
Thank you, and take care.
You too.
Bye.